right, welcome back to another episode of the Digital Health Podcast. We have an amazing episode for you guys. If this is your first episode, my name is Anthony Virgo. I spent the last 7 years at a health tech startup, and now I am leading my own AI agency along with my partner, Kazar. Kazar, go ahead and introduce yourself for the team here.
Hello everyone. My name is Faiza Shahid, and let me introduce myself and a company who are the brand new to this podcast. So I've been working in the healthcare domain for quite a while. We just started our AI agency, and now we are working with a lot of healthcare professionals. We are working with psychologists, psychiatrists, physiotherapists, dentists. So this is the brief introduction about us. Now I want to kick it over to our guest.
Well, hi, Anthony and Kazar. It's good to meet you guys. I'm happy to be here. My name is Ryan Engelstad. I'm a therapist based in central New Jersey, but I'm doing all of my work right now through Headspace, which is a mindfulness and meditation app primarily, but also has a therapy component and coaching and psychiatry as well. So I've been a therapist in different capacities for almost 20 years, and obviously technology has evolved and changed my job a great deal. So I'm sure there's lots we'll be able to talk about with that.
Definitely. So first and foremost, just want to thank you for, just being on and your time. So one of the first questions we love to ask our guests is, how did they actually start their journey into healthcare? Like, where did this come from? And the reason why we ask this is because we're finding a theme, pretty much two things when it comes to people in healthcare. One, you have someone who healthcare has been a straight and narrow path, right? They knew that they were going to be a doctor, a therapist, a dentist, right? And they knew from a young age that this was what they were going to do. And then there's another pocket of people who kind of fell into healthcare by accident. One being myself. I was a car salesman before. Now my healthcare. Two different industries, two different lay of the lands. But I found myself in healthcare and then also falling in love with the industry. Not just because of the impact that we were making on people, because, I definitely love that part of it. But it also allowed me to understand my health or take my health into my own hands as well. So my question is, how did your health journey start for you in becoming a therapist, or just in general? Where did you bit the bug and how did that happen for you?
Yeah, I'm definitely more in the first category. All the way back in college and undergrad, I had an internship at a inpatient substance abuse clinic where people would come into inpatient for drug abuse or alcohol use and would live there at the facility for 90 days all the way to 6 months. It was a very intensive program, very old school. So just kind of being in that very intense environment, but also seeing the progress and seeing how people's lives were changed through therapy and psychiatry and group therapy, individual therapy, all the different aspects of that process I got to see at a pretty young age in my own education. So seeing that process, I was like, okay, I want to be doing this work with people. I want to help people change their lives. I want to help people learn and grow and deal with things like trauma and overcome some of these mental health challenges that people can run into for all different sorts of reasons. And I was lucky enough to be offered a job at that same clinic after I graduated. And I was there throughout my getting my master's. And that really kind of sealed the deal that I got to go from, basically doing an introduction to just, doing interviews with people and, helping people get started in the program to actually being a therapist within the program. Within, whatever that was, 6 or 7 years or so. So I really got to experience a lot of growth in a short time span. And it certainly informed like what kind of work I really enjoyed doing. So over time, I got more into doing just individual therapy, sort of private practice in different forms. Because that's where I just feel like you can do the most progress. Group therapy is amazing. I will say for me, I found the work to be a little repetitive. So you can run the same group on, overcoming your triggers, dozens of times, and you start to feel like, oh, it feels like we're having the same conversation over and over again. And that certainly has its benefits, but I really enjoyed doing individual private practice sort of model of therapy. So ever since then, I've been doing that in different forms and in different locations.
Definitely amazing. So yours was definitely straight and narrow. At least you found your home early, I want to say.
Yeah, for sure.
Especially, being an undergrad, getting your master's and all that.
Yeah.
So we talked about a few things a little bit. As you were speaking, I heard substance abuse and I heard trauma. And we
Yeah.
know that with mental behavior health, anything like that, there's different levels and different ranges in terms of how someone could be impacted mentally, right? It's
Absolutely.
not just one thing, there's a pocket of things. So I guess from your perspective as a therapist or just from your experience, what is one misconception about therapy, whether it's someone coming for trauma or they're just coming because they're not having a good day? What is some misconceptions that you could maybe share that the average person doesn't know?
Yeah, for sure. I think most people see therapy as like something you go to when things are really bad, right? Oh, my relationship's at the risk of getting divorced, right? Or, I went through some trauma, so yeah, I guess it makes sense to go get some help. And those are great reasons to get support, but also I like the medical model, which is basically, you would go see your doctor if you weren't feeling well to figure out why you were, having a hard time sleeping or had a fever for a couple of days. You would get that treatment or you get that support, start to feel better. You would get a treatment plan, how to continue to take care of yourself well. They say, okay, doc, thanks. I'll see you when I need you next. So I think there's a model for that with mental health that really is not taken advantage of. That, to your point, you could be having a bad day or a bad week or bad season. We talk about things like seasonal depression, where some people just think, oh yeah, it gets dark out and I'm just sad. And it's like, well, there could be a little bit more going on there. So being able to build that sense of self-awareness. I'm big into skills and homework. So in terms of a therapeutic approach, feeling like you can actually take things away from therapy, that it's not just a place you go to vent for 45 minutes to 60 minutes and the therapist is just going to nod their head and say, how does that make you feel over and over again? Like there's a lot of versions of therapy that are not that at all. And I think if you can have a sense of what you're looking for and what's helpful for you, you can really get a very different experience than what you might be expecting.
Definitely.
Then you just mentioned the group therapy. So is the group therapy equally effective, just like giving the in-person consultation, or the consultation to just one person?
Yeah. So for me, and there's two different aspects to this question because there's in-person versus virtual now with, people being able to do therapy from home. But there's also the sort of consultation, which might just be a one-off meeting with a therapist and an evaluation. I do encourage people, if you've never been to therapy before and you're not sure if it's right for you and you have the resources that are available, absolutely go for that first session consultation. In the same way that if you're having heart problems, you might go have an initial meeting with a cardiologist, but maybe you want a second opinion. Maybe you want to see a different cardiologist who specializes in something that you're interested in or, specializes in a genetic condition that you might be worried about. And I think therapy can be very similar in that you can have an initial consultation or an evaluation with a therapist, see if that feels like a good fit, get a sense of what their specialties and approaches are, and then decide, oh, yes, I would like to see this therapist. Or, oh, you know what, I think I'm looking for someone with the psychodynamic approach or who does EMDR. There's lots of different, approaches and backgrounds out there. Can you help me find someone like that? And most therapists are thrilled to know that someone wants therapy and knows what they're looking for, and we can offer those consultations and those connections to get you the help you need.
Definitely. I think, like we were saying before, just how health shows up in different ways. How you get help for that help. Might show up a little bit different as well. As you said, therapy could look and feel different, right? It isn't just you laying on a couch and you spilling your head out, and then someone's at a notepad. It's interesting because I came into healthcare. At least when I came into healthcare around like 2018. Well, I was in my startup around 2018. I probably came into healthcare around 2015 or so. And at that time, the concept of telehealth was super new, brand new. And even me, myself, I was like, people are never going to get on a computer and see a primary care doctor, a therapist, right? A psychiatrist. I just didn't see it happening. Post pandemic, a few years later, now it is the norm. And we even see, right? We even see like mental health or getting some type of counseling has always been a stigma. But now you're able to kind of do it from the comfort of your own home, right? You don't have to worry about traffic, right? Going on the subway in New York if you're in Brooklyn. You know that subway is the subway is a mental hurdle in itself. So,
Finding parking,
right. So you had all these barriers that prevented someone to actually go seeing a therapist, but now it's like all those barriers are removed. Are you finding that in today's day and age, people are actually preferring the virtual treatment versus the in-person, or is it still kind of half and half?
It's a mix, and everyone has their preferences. Myself, I went from seeing people 100% in person previous to the pandemic in Princeton, New Jersey, to the pandemic really forcing everyone online for a period of time. And then for me, it just made sense to keep things that way. So even if I had the opportunity to go back to in-person, through being a therapist with Headspace, I've been able to stay virtual and see, 20 to 30 people a week. I get to see people from their cars at lunchtime when they're at their office. And, and now offices have like private spaces to do exactly this kind of thing, which is amazing. So there's different ways that I think we've leaned into the convenience. There are definitely benefits to, being able to see people in person. Some people are just more comfortable if they're not on a screen and having to worry about Wi-Fi connection and good audio and stuff. But I will say for me, the convenience really outweighs any of those specific challenges. People can be in their bedroom, in the bed, under the covers. I couldn't feel like I was getting out of bed today. And they wouldn't have had therapy, 7 years ago if that's how they were feeling. They would have skipped or canceled, right?
Right. 1,000%. And you said something a little bit earlier in terms of like it being super convenient and easy, right? Because of this new technology. But now we have something else, which is AI, which is, I want to say, shaking up everyone's industry in some way, shape, or form. Not just healthcare, right? We're hearing it in like the law office and hospitals. A bunch of people are incorporating AI. What is your take on it in the healthcare industry as of right now? What is your, are you for it? Are you against it? What are you seeing some trends that, might be turning some wheels in your head?
Yeah, it's really interesting. There are different aspects to it because obviously for us at Headspace, AI has taken a couple different forms.
Right.
Headspace has created like a AI assistant. It's called EBB. So it's like a little chat bot that, you can talk to in between sessions and it can help you practice mindfulness skills. And that's great. I got no issues with that. We've been really smart about putting guardrails and making sure it refers people to proper resources if it detects, certain signs of high risk. And Headspace included. A lot of platforms use AI for like digital note taking, recorded sessions, which we're very careful about. We only do it at intake right now. But a lot of platforms out there do fully recorded sessions with AI and fully automated notes. So you see a lot of different things. But being able to have that as a mental health resource, I think is where I start to get nervous, right? I think a lot of, especially young people, are all the evidence and research here suggests that a very high percentage of people are using AI as emotional support, right? Or even like using it as a quote unquote therapist, right? You go to like Character AI, they have a therapist, bot basically. So I think if you're using AI for those purposes, it's not therapy. What it is we think of it as like, I personally think of it as like a validation engine, right? So it's going to tell you what you want to hear.
Right.
It's going to, even if the thing that you want to hear is not the best thing for you. And that's the way in which it differs a lot from actual therapy, that a therapist is going to to push back, is going to challenge, is going to ask a question if you say something that's confusing, instead of just being like, yeah, that sounds great, you should go do that thing, even if there's no appropriate context to that plan. So I'm happy to kind of address any other specific concerns that you guys have, but that's where I'm looking at it as like certain tools that have benefits and certain use cases which have a lot of risks.
Right, 1000%. And I think that's, you're not the first one to have said something like that. We've even had talked to someone where someone was actually like they were combating their therapist based on what ChatGPT was saying in their session. So we do hear these cases, and I'm not even sure if it's like, is that extreme or is that gonna be the norm after a while?
That's a good question.
It's like when social media first came out, no one knew what social media was gonna do. It was just like a thing to do. Now fast forward, we've had this thing for a while. We know exactly how social media affect someone's mind, body, and soul, right? Like if they're waking up going on Instagram, are they subconscious, or are they looking at the news and seeing something traumatic every morning? All of that impacts someone. With AI, it's like there's a bunch of moving parts. There's a bunch of good things and bad things, and things that we have questions about. The good thing about AI, though, I think it's allowing people to be present, especially like clinicians or therapists, right? You said something about like taking notes and things like that. It's going to allow people to kind of be more present in the moment, and they don't have to worry about, oh, did I spend 45 minutes on the documentation to make sure it was right after a long session that they had to speak with.
Yeah, because I think that is and everyone feels differently about a session being recorded. So I think if that's a concern for you, like ask any questions that you have. By all means, like ask if it's stored, ask what it's done with, ask how long until it's deleted, like advocate for yourself as a patient for sure. I think from what I've seen so far with that, it feels like there are more benefits than risks, just as far as like the note taking. Because to your point, if I'm also talking to you while I'm typing, and trying to kind of stay on track of, making sure my note is fully filled out,
right,
versus just having the conversation and feeling like that's going to happen sort of automatically with all the proper information that needs to have, like that just feels like a net win for everyone. So I'm all for tools being explored in that way. But to your point, if we start to use it in all these other ways, at what point is that doing more harm than good? And there have been, unfortunately, like plenty of examples where it's doing a lot of harm.
Right, 1000%. And I will always say, like you mentioned something about guardrails earlier, what you guys are doing over there at Headspace. It's important to have those guardrails when you're doing with AI. And what we tell a lot of our clients, or what we found out as well as we're working in the healthcare field with AI, is we are seeing there's a trend of, the people who are implementing the AI tools itself might not even have a healthcare background. So how are you able to implement a tool that's supposed to increase patient satisfaction when you've never sat down with a patient, right? Mrs. Jones might be on the verge of an eviction. She might be in a food desert, can't eat organic foods, right? She's missing her therapy appointment because she wants to pay rent. How would a AI developer know that without actually having a background to know what the healthcare experience happened on the ground floor and also at the top? So we always suggest that it's always important to work with someone who has the expertise or the niche within the domain to implement the AI tool for sure.
Yeah, I love that. Yeah, because that's you're not just assuming because you have a fun AI idea that it's going to have all the intended outcomes that you want.
Right.
You're bringing in experts that are on the front lines of knowing how people might use this in their industry.
1000%. And I know you mentioned a little bit about Headspace, and I know you guys are like an innovative company from, like I mentioned, my company before you guys were a resource. So I always was going into Headspace and listening to the sounds and figuring it out. Outside of that, though, in your world, or just like the clinicians or the providers that you might interact with on a day-to-day, what are their thoughts or impressions about AI? Are they using it? Do they see it as a fun tool or a great tool? What is your perspective on that?
Yeah, I think it's a mixed bag. I think early on, in like the first development of some of these things, it did feel like a fun tool or almost like a toy to experiment with,
Right.
right? And then you start to think about the implications of data sharing and like the ways that these tools are responding and in some cases like encouraging certain behaviors and
Right.
certain outcomes. And that's where you start to see these edge cases of like, oh, well, I didn't necessarily think that that's how that would happen,
Right.
right? It could start with, oh, ChatGPT, like I've been having a bad day. And then it might end with like, some of these crazy stories you hear in the news where it's like, oh, I was thinking about like doing this to myself or hurting myself in this way.
Right.
Do you think it's a good idea? And it's like,
Right.
oh, well, if you want to do that, here's how to do it. And
Hmm.
it just follows you. It
Right.
just validates and it just, for the most part, and obviously I'm sure they're trying to change this, but there have been way too many examples of like, oh, is this what you want to happen? Like, then sure, I'll walk you through the steps that are necessary, right? Whereas if you were talking to a human, they'd be like, whoa, and
Yeah.
we would get the hospital on the phone and we would make sure you had the proper care and all the different resources to make sure there wasn't going to be that outcome, because that is our first guiding principle is do no harm and
Right.
ensure patient safety. And with the way these large language models work, it's trained to kind of follow you, that if you want something, that it's its job to kind of go where you want it to go.
1000%. And I mean, you're right. It's like going back to the guardrails conversation. Like, you want to be able to make sure these things are HIPAA compliant and have your best interests and, a lot of these things. So you got to look at who's building this stuff, or,
Yep.
how long is it going to take? Like, anyone, it's like, for example, like, we're in the healthcare industry. I'm not making AI agents for, say, hotels. Not to say that I can't create a cool, fun agent that's going to handle everything a hotel might want, but
Yeah.
I might not know the nuances or the use cases or the day to day. So I might miss the target.
Yeah.
Versus if you have someone in healthcare, or you have all the players in the room, right? You have the AI partner, and then you also have the therapist in the room. You have the behavioral health specialist. You have the social worker to then say, hey, this is how we can make this thing better for everyone.
Yeah.
And then that way people will start seeing like ROI on, some real fruitful AI tools out there.
Yeah, for sure.
1000%. So, I mean, we usually wrap things up with two last questions.
Great.
One, Ryan, we want to ask, what are the best channels to contact you? A listener
Sure.
might have heard something really interesting and want to ask you a question, or just want to reach out in the future. What are the best channels to reach out, whether it's LinkedIn, Facebook, or any of those? And then also, what's one powerful message you would love to leave with our listeners? This could be related to anything we spoke about today or from your personal experience. Just give us the powerful message and then your channel so we can wrap this thing up.
For sure. So if you want to hear more from me, there's a couple different places where I've produced a lot of information and content out there, not just for patients, but for people at large as well. I had a podcast for several years called Pop Psych 101, which you can find on Spotify and Apple Podcasts. My co-host and I broke down a lot of mental health concepts through the lens of popular media, so movies and TV and books and stuff like that. So I talk a lot on there. The Headspace podcast, Dear Headspace, is a podcast that I was on for a while, just sort of answering a lot of general questions about mental health and mindfulness and self-care. And if you want to reach out to me, I do have my podcast channels are all still available. So you can find me at Pop Psych 101 on X and Instagram and even like Gmail. You can also reach out to me on LinkedIn. I'm there as well. So happy to field requests and questions through those channels. As far as, man, I mean, my immediate thought based on the fact that we're talking about AI and and I'm sure you guys know this is too as well, like the loneliness epidemic is a real thing.
Right.
And not just for men, I think for everyone. I think the
Right.
more we use social media, the more we use AI, the more we are turning away from people, unfortunately, and turning away from in-person opportunities. I know for me, and the pandemic was a big part of this, which has had its benefits that we created all these amazing tools, but we also like hide out at home or in our apartments way more than we used to. So if you have an opportunity to do something in person, I advocate for people to take that step first. Yeah, there are going to be tools that help us to connect online. Those are not going anywhere.
Right.
Like we're never really going to get rid of social media. The cat's out of the bag with AI as well. But we don't want to lose, clubs and groups and after school activities and things that you can join. I play basketball 2 or 3 times a week with a group of guys. Like
Right.
those things are so important for keeping you connected, for leading to other good opportunities to connect with people. And I just think we have to kind of not protect those, but really push ourselves outside of our comfort zone every now and then. It doesn't have to be like you're forcing yourself to do something all the time.
Right.
But that really does a lot of good, both for your brain and for your body. So whether it's therapy or seeing friends or hobbies, like be in the world as much as possible.
Definitely. And
So,
that's
Ryan,
amazing. I think that
are you
touches on
also
like
running your own? Are you also running your own podcast? And you just mentioned about the podcast.
So yeah, I am not actively recording episodes. I've got like 100 episodes in that are in our channel. So it's on pause for right now. But there may be some things coming up in the future. I also wrote a lot on medium.com. I have a whole bunch of articles there about mental health and self-improvement. So you can check me out on those channels as well. But yeah, my podcast is called Pop Psych. That's POPPSYCH 101. And that's on Spotify. It's on all the podcast channels. But we did yeah.
All right, so thank you again for your time. This has been amazing. We're excited to maybe have a part 2 with you later down the line because we understand that AI might be completely different by the time this
Hopefully for
episode
better.
out.
Yeah.
Right. So we would love to have you on again. But thank you so much, Ryan. We appreciate your time and we appreciate you here at the Digital Health Podcast.
For sure. Thanks, guys. Take care.